Today we're going to be talking about proper handling, safe handling for patients, especially babies with fragile bones. So prior to doing any handling, of course, we're going to want to have our clean hands. First, I'm going to go over what not to do. What are some unsafe techniques? You never want to pick up the baby with fragile bones under the armpit. You don't want to pull on their arms or pull on their legs in order to do their cares, as this predisposes them to having fractures. Things that you do want to do. First, we will start with a safe diaper change. Whenever you are handling the baby's legs for a diaper change, you want to keep the legs supported, possibly under your forearm, with your fingers spread out wide to spread the area where you're applying pressure under the buttocks and lift the buttocks that way. Again, keeping the legs supported in order to slide the diaper under the infant. And as you bring the legs down, you want to guide them, gradually maintaining that support as to prevent dangling against gravity. Whenever you are doing any of these cares, take care not to push, pull, bend, or twist the infant's arms or legs. When you are doing infant dressing, you will want to use a size or two larger than what the baby's actually size is in order to make this dressing and undressing safer and easier. You always want to try to bring the cloth towards the baby, not bring the baby's limb towards the cloth, as that traction or pushing and pulling could cause a fracture. So we'll start with getting the head into the onesie. I'm going to guide the cloth over, spreading out my fingers to gently cradle the head and bring it up. I'm again moving the cloth, not moving or pulling on the baby. From here, I'm going to bring the arm up, supporting it, preventing any dangling against gravity. And again, I'm going to bring the cloth, guiding it over the baby's hand in a gentle motion, supporting that arm, while again I bring the cloth over to complete the dressing here. Similarly, for undressing, I'm going to keep that joint supported, and I'm going to again guide the cloth off by pulling on the cloth, keeping those proximal joints supported with my fingers spread out wide, and pulling the cloth, not the baby's limb. I'm going to bring it down slowly, supporting it until it is resting so that it does not dangle against gravity. Again, I'm going to pull on the cloth to safely remove it from the baby's head. Now, if I wanted to do any burping for this baby, in order to pick up the baby, I want to support his arms and legs. So I'm going to bring them into a more midline position so that they do not dangle against gravity. Again, using my forearm to support the legs and then guiding my hand under the buttocks. I can bring my chest closer to the infant to make this easier, cradling the head and neck with my fingers spread out wide behind the head and minimizing the time where the child is floating free. As I'm holding the baby, I want to take care that the arm or leg is not twisted or held in an awkward position against them. Again, supporting those limbs against gravity. Now, to birth the baby, I can do gentle circular motions along the baby. I can even take some gentle bouncing steps while I'm keeping the limbs and head supported well. I can also birth the baby with a cupped hand position like this, gently. Now, if I'm teaching a mother to do breastfeeding for the baby, you want to use a cross cradle hold, not a football hold, so supporting the entire body during that breastfeeding. So I'm going to gently bring the baby in a lower position, but still keeping those limbs and head supported against gravity, basically crossing my arms across my body in order to maintain that cross cradle hold. Now, sometimes you might have a baby that is premature or might be withdrawing from medications and may be very irritable and difficult to do the cares. And at this time, you would want an assistant to help you in performing these cares to maximize the safety of the patient's bone health and also make the cares easier. So for that, I'm going to lay the baby again gently down on the surface where I can have both myself and an assistant being able to reach the baby. So for example, we'll do a diaper change, possibly with an irritable baby, where I'm going to have an assistant to help me. For this situation, I will again do the handling and supporting the limbs while I have my assistant slide the diaper in and out. So I will again give my forearm support under the baby. I'm going to again lift from under the buttocks, getting the diaper positioned, and then gently bringing down those limbs, supported throughout the range against gravity. Now, if this baby was still irritable for the cares, I might ask my assistant to offer containment over the head and at the feet, just applying a very gentle pressure inwards to try to mimic the intrauterine environment to maintain a more calm state during the cares. We could also try dimming the lights or providing the pacifier for a non-nutritive suck in order to keep the patient calm. You can also do that nice cradle hold during some of the dressing changes in order to maintain a calm state during cares. Thank you.